She was 72, a non-smoker, and active. Yet, she had a heart attack at 2:30 in the afternoon, lying on her couch. Reviewing her history, one detail stood out. She napped for 2 hours after lunch every day, always on her back. I'm Dr. Robert Caldwell. After 30 years in the operating room and 2,000 surgeries, I've seen what most checkups miss. What I'm about to tell you rarely comes up in routine appointments, but it's vital for your heart. And most people have no idea where that line is. Meta-analysis published in the journal Sleep, covering 11 prospective cohort studies and over 151,000 participants followed for an average of 11 years, found something striking. Naps of 60 minutes or longer were associated with an 82% higher risk of cardiovascular disease compared to no napping at all, not 10% higher, not 20%, 82%. That is the kind of number that changes how a surgeon thinks about a patient's daily routine. A separate analysis of over 313,000 participants across more than 20 studies presented at the European Society of Cardiology confirmed it. Long naps, defined as over 60 minutes, were associated with a 34% higher likelihood of cardiovascular disease. The same study found a 30% greater risk of all-cause death compared to non-nappers. These are not small studies with questionable methodology. These are population-level findings replicated across multiple countries and cohorts. Here's what makes this even more critical for people over 60 specifically. In the subgroup analyses, the association between nap duration and cardiovascular risk was strongest in older adults, not in middle-aged or younger people. The same nap that carries minimal risk at 45 carries a measurably different profile at 68. The body after 60 does not respond to afternoon sleep the same way a younger body does. The physiology has changed, and the risk has changed with it. But here's what I want you to understand before you dismiss afternoon rest entirely. The research shows a J-curve relationship between nap length and cardiovascular disease, not a straight line, a J-curve. What that means is this: risk actually decreases slightly as nap duration increases from 0 to about 30 minutes. A short nap, properly timed, is not just harmless in a body over 60, it is genuinely beneficial. It reduces inflammatory markers, it lowers cortisol, it supports the kind of afternoon blood pressure dip that protects your endothelium. The problem starts right around the 30 to 45 minute mark. It becomes significant past 60 minutes. That is the threshold, and that is where the biology shifts. So the question I want you to sit with is not whether to nap. The question is, what is happening inside your cardiovascular system when a nap goes past that threshold, and why does the older body respond so differently? To understand that, I need you to think about something called sleep inertia. When you fall into deep slow-wave sleep, which happens around 20 to 30 minutes into a nap, your body begins a cascade of physiological changes. Blood pressure drops, heart rate slows, respiratory rate decreases, peripheral blood vessels dilate. Your autonomic nervous system, specifically the parasympathetic branch, takes over completely. In a healthy young body, waking up from that deep stage is managed smoothly. The sympathetic system reactivates, blood pressure rises, the body transitions back to wakefulness without significant cardiovascular disruption. In a body over 60, that transition is not smooth. The baroreceptors, the pressure sensors inside your blood vessels, respond more slowly. The vascular walls, already stiffer from years of collagen replacing elastic tissue, cannot rebound as quickly. Blood pressure can drop sharply upon waking and then surge as the body overcompensates. That surge, an exaggerated post-nap blood pressure spike in stiffened arteries, is one of the key mechanisms researchers believe drives the elevated cardiovascular risk. Each long nap creates a mini version of the morning surge we associate with peak heart attack hours. And in a person who naps for 90 minutes every day, that's a cardiovascular stress event happening 365 times a year. There's a second mechanism that gets far less attention. Long naps in older adults are frequently a signal, not just a cause. They reflect fragmented or insufficient nighttime sleep, and fragmented nighttime sleep is itself a powerful cardiovascular risk factor. When you're not getting restorative deep sleep at night, your body tries to compensate in the afternoon. But the physiology of afternoon sleep is not the same as nighttime sleep. The hormonal environment is different. The circadian context is different. What you're getting in a 2-hour afternoon nap is not the same recovery your cardiovascular system receives from proper nighttime sleep. It's a poor substitute that creates its own disruption. A 2023 Mendelian randomization study established causation, not just correlation. Daytime napping was causally associated with a 71% increased risk of heart failure. The same study found a 51% increased risk of hypertension, a 71% increased risk of atrial fibrillation, and a 47% increased arrhythmias. Causally associated, not just correlated. That is a different level of evidence, and it matters. I also want to talk about the position in which most people over 60 nap. This is something that never gets discussed, and it has direct cardiovascular consequences. Most people nap on a couch or a recliner, slightly elevated, not fully horizontal. Some nap flat on their backs. The position matters for two reasons. First, lying flat on your back increases the risk of upper airway obstruction, particularly in people with undiagnosed sleep apnea, which affects over 30% of adults over 60. A long afternoon nap on your back may involve dozens of micro-apnea episodes that trigger stress hormones and fragment sleep quality. Second, the transition from horizontal to vertical when waking from a deep nap is the exact scenario that triggers orthostatic hypotension. That's a sudden, sharp drop in blood pressure upon standing. In a person over 60 with already compromised baroreceptor function, that drop can be severe enough to cause dizziness, falls, or, in the presence of vulnerable coronary plaques, the hemodynamic disruption that triggers a cardiac event. The woman I told you about at the beginning, she was napping flat on her back for 90 minutes, in a room she kept warm because she got cold easily. She woke up, stood up, walked to the kitchen to get water. The combination of deep sleep inertia, post-nap blood pressure surge, orthostatic drop, and warm room dehydration created exactly the hemodynamic environment her cardiologist had been unknowingly watching build for 3 years. His normal daytime readings told him everything was fine, everything was not fine. So what does the evidence actually recommend? I want to be precise, because the answer matters. A nap of 20 to 30 minutes, no longer, taken before 3 p.m., appears to be the protective window. This keeps you in the lighter stages of sleep without entering slow-wave deep sleep. You wake feeling refreshed rather than groggy because you haven't triggered the full sleep inertia cascade. Your blood pressure doesn't experience the sharp reactivation surge. Your cardiovascular system gets a genuine rest without the disruptive waking transition. Set an alarm, not as a suggestion, as a rule, 20 minutes, 25 if you need a few minutes to fall asleep, no more. The difference between a 25-minute nap and a 65-minute nap is not a matter of degree. It is the difference between crossing a biological threshold and staying safely on the right side of it. Time your nap before 3 p.m. Afternoon sleep taken later than mid-afternoon begins to interfere with nighttime sleep architecture. That creates the exact fragmentation that leads to longer daytime napping the following day. A cycle that feeds itself. Cool your room slightly before lying down, not cold, cool, between 18 and 20 Celsius. This prevents the sweating and fluid loss that contributes to blood thickening during sleep. Drink a glass of water before lying down. When you wake, sit upright for 1 to 2 full minutes before standing. This is not optional after 60. Give your baroreceptors time to respond. Give your blood pressure time to stabilize. That 2-minute pause is one of the most protective cardiovascular habits an older adult can build into a daily rest routine. And if you are regularly napping longer than 60 minutes, if you wake from afternoon naps feeling more confused or more tired than when you lay down, that is information your cardiologist needs to hear. Not because the nap itself is a crisis, but because excessive daytime sleepiness in adults over 60 is frequently a marker of undiagnosed conditions. Sleep apnea, early heart failure, nocturnal blood pressure dysregulation. These are treatable. I also want to address something I know some of you are thinking right now. You've read studies saying that napping is protective, that Mediterranean populations who nap regularly live longer, and those studies exist. I'm not dismissing them. What they consistently describe is short, occasional napping in people with adequate nighttime sleep. That is entirely compatible with everything I've said today. The protective studies and the harmful studies are not contradictory. They are describing different behaviors in different populations. The protective studies describe naps of 20 to 30 minutes, taken once or twice a week, by people with good baseline sleep quality. The harmful studies describe daily naps exceeding 60 minutes in people with fragmented nighttime sleep and elevated cardiovascular risk profiles. That second description fits a large proportion of Americans over 60. The nuance is the entire point. Understanding which side of that description you fall on could change what happens to your heart over the next 10 years. I had a patient who started setting a 25-minute alarm for his afternoon rest 6 months after this conversation. He called it the most annoying habit I'd forced on him. His nighttime sleep improved within 2 weeks. His morning blood pressure readings dropped by 8 points without any medication change. He felt clearer in the afternoons than he had in years. Nothing dramatic, just the body responding when you give it the right conditions instead of fighting against them. Here's what I want you to take from this video. Think of your post-lunch hour the same way you think about your medication timing, your dinner hour, your bedroom temperature. It is a cardiovascular variable. It is not neutral. Every day that you lie down and set an intention about how long you will sleep and what conditions you'll sleep in and how you'll transition back to standing, every one of those days is a day you are either adding to or subtracting from the cumulative load on your coronary arteries. 20 to 30 minutes. Before 3 p.m., cool room. Water before you lie down, seated pause before you stand, an alarm that you respect, not because you have to, but because you understand what's on the other side of ignoring it. That is not a dramatic intervention. That is one of the simplest, most evidence-backed cardiovascular protective habits available to any person over 60, starting this afternoon. Look, I'm a surgeon, but I'm not your doctor. Everything I've shared today is grounded in published cardiovascular and sleep research. Before making changes to your routine, especially if you're managing heart disease or hypertension, talk to your physician first. What I want is for you to bring this information to that conversation, because the length of your afternoon nap is a cardiovascular decision. And now you know exactly where the line is. Take care of that heart. It doesn't stop working when you lie down. It just changes gears. And after 60, those gears matter more than most people realize. There is one more thing worth saying, specifically for people who feel they have no choice but to nap long because they are genuinely exhausted every afternoon. That exhaustion is real. I am not dismissing it, but it is frequently not a napping problem. It is a nighttime problem that has been left unaddressed. Fragmented nighttime sleep, undiagnosed sleep apnea, nocturnal blood pressure dysregulation, and medication side effects. Many common blood pressure drugs and cardiac medications are known to fragment sleep architecture. Any of these can create daytime sleepiness that feels impossible to resist. The answer is not to white-knuckle through a 25-minute alarm when your body is genuinely depleted. The answer is to find out why your body is depleted. Ask your doctor for a sleep study. Ask about nocturnal blood pressure monitoring. Ask whether any of your current medications could be contributing to your afternoon exhaustion. Address the root cause, because the long nap is often a symptom, and treating the symptom without addressing the cause is exactly the kind of incomplete medicine I've spent 30 years watching lead people to my operating table. The 82% elevated cardiovascular risk associated with long naps is not a prediction that you will have a heart attack tomorrow. It is a measurement of cumulative load, the cardiovascular cost that accumulates over months and years of repeated long napping in a body with less physiological reserve than it had at 45. That distinction matters because it means every afternoon is a decision. You cannot undo last year's naps, but you can change what happens to your cardiovascular system starting today. The body's response to better habits is measurable, sometimes within weeks, always within months.